Welcome back to Coffee Chats with Tiffany. Today we are discussing an extremely confusing topic that we get questions on all the time. What is the difference between Medicare, Medicare Advantage, Medicaid, and Medicaid Waiver? So I'm going to walk through those four different differences, and then I actually have an in-depth blog post at silverlininghealthcare.com. If you want to go more in depth and you want to have easy access to resources related to this topic, we have a whole bunch of hyperlinks and key resources. So Medicare, Medicare Advantage. Medicare can actually be administered in two different ways. Original Medicare, or just Medicare, and then Medicare Advantage. They are both insurance coverage, and they have three parts available. Part A, which is hospital coverage. Part B, which covers outpatient medications. And then Part D, which is prescription drugs. So Medicare is run by the government. Medicare Advantage plans are run by private health insurance companies. They have to abide by federal government regulations. So the government says you have to at least provide this, and then the Medicare Advantage plans can be administered. The Medicare Advantage plans typically have additional coverage for things like vision, dental, and hearing. And there are a ton of different options. So there are some really cool like health insurance finder tools out there. Again, you can take a peek at our blog post on that. If you're eligible, you can pick which plan you get and whether you go with Medicare or a Medicare Advantage plan. There are three main ways to be eligible. You're 65 or older. There are some individuals who are disabled that qualify, and then individuals diagnosed with end-stage renal disease, ESRD. So the difference in the costs, well, for Medicare and Medicaid, Medicare Advantage, for Part A, most individuals do not pay a premium for Medicare. The Medicare program is primarily funded by taxpayer dollars. For Part B, all individuals pay a premium, and that amount just depends on the amount of coverage you have. And for Part D, all individuals pay a premium. The amount depends on the amount of coverage that you have again. So original Medicare typically covers 80% of expenses, which is why many individuals will then choose to purchase a Medigap policy. You might have heard of Medigap, which that helps cover the other 20%. So that's Medicare and Medicare Advantage. They're insurance coverage, major medical insurance coverage, and then they have some supplemental. Is one better than the other? That's so dependent on you and your situation. A lot of Medicare Advantage plans, and why we're seeing people start transitioning to more of those, is that they can offer some unique benefits, assistance with home care, handyman services. So depending on your local area and the different insurance payers out there that are providing different plans, it could be a better fit for you. So Medicaid and Medicaid Waiver. Medicaid is a federally created, state-run, and then joint funded, so federal and state funded, major medical health insurance coverage. So this provides coverage to children and adults who are eligible. It is actually the single largest source of healthcare coverage in the US, so a little fun fact for you. Who is eligible for Medicaid? There's both non-financial and financial factors to eligibility. Non-financial include being a resident of the state from which you're getting coverage, and being a U.S. citizen or of a specific U.S. legal status. And then financial eligibility looks at your MAGI, the modified adjusted gross income. And then there's just additional covered groups are kind of state dependent. Medicaid waiver, on the other hand, is not a major medical insurance. This is so important. These waivers are actually programs that differ state to state that offer supplemental coverage. So in Delaware, for instance, there are 4 Medicaid waiver programs. There's the elderly and disabled, there's assisted living, there's AIDS, HIV, and there's developmental disabilities. So each of these programs is a home and community-based service waiver program, and it provides different services to different groups of individuals. Each of the 4 programs have their own non-financial and financial factors for eligibility, and the financial eligibility is different from Medicaid eligibility. So again, Medicaid and Medicaid waiver are two totally different things. In Delaware, there's 2 privately held companies that administer home care under the elderly and disabled home and community-based care waiver, and that's AmeriHealth and Highmark. So Silver Lining, we do participate with both companies to offer that best of home care to these clients. And if you are eligible to receive services through a Medicaid waiver, and you'll have a case manager with AmeriHealth or Highmark, and we will get an authorization. And when that happens, our clients don't pay any fees. So when authorized care is implemented and provided, then the client doesn't pay any fees. So to learn more about our services, to learn more about, Medicare, Medicare Advantage, Medicaid Waiver, Medicaid, all of that, please come visit us on our website, silverlininghealthcare.com. Go to our blog, go to our resources page, and we'll talk to you soon.